Hi, my name is Zach Talbott. I'm the director of the Tennessee statewide and Northwestern Georgia chapter of the National Alliance for Medication-Assisted Recovery. NAMA Recovery is an organization composed of methadone and buprenorphine patients, healthcare providers, family and friends of patients, and just in general people who support quality opiate agonist therapy. The Centers for Disease Control and Prevention, the CDC, has referred to methadone maintenance treatment specifically as the, quote, most effective treatment, end quote, for opioid addiction. The National Institutes for Health, the NIH, has referred to methadone maintenance treatment as the, quote, gold standard treatment, and called on insurance companies and governmental agencies to stop blocking access to this life-saving medication. Methadone maintenance treatment and, more recently, buprenorphine treatment in medications like Suboxone, Subutex, and Zubsolv is some of the most evidence-based and proven effective approaches to this disease in existence. But not only that, they remain some of the most evidence-based and proven effective treatments in all of medicine, not just for opioid addiction. Yet at the same time, they remain some of the most stigmatized and some of the most misunderstood treatments as well. This negativity and this stigma can impact on the self-esteem and the self-worth of patients who in reality should be proud of the accomplishments they've made in treatment and in recovery. Patients who have largely gotten on along with life, patients who have gone back to work, gone back to school, who have gotten custody of their children back, who are living as productive members of society. These patients feel sometimes the stigma is so strong from this misinformation and the misconceptions, and for many it can be just as painful, if not more painful, because of the accomplishments you should be celebrating. Just as painful, if not more so, than the stigma of active heroin or prescription opioid abuse and addiction. But NAMA Recovery has come together. We're an organization that is convinced, and our slogan is, together we can make a difference, and we truly believe that, and we have seen that. Thanks to NAMA Recovery's efforts, we have seen regulatory changes come about that without patient and advocate involvement may not have happened. And more than anything, it gives patients a powerful affirmation of pride and unity, I believe is how it's worded on our website. So if you're a methadone patient or a buprenorphine patient, if you're a family and friend of a methadone patient, we invite you to join with us, to join NAMA Recovery. The opiate addiction and overdose epidemic that our nation is facing, we've got to find effective ways to approach it, to address it, and to turn it around. And the reality is we have the answers. We know the truth. We've got almost 50 years of research. And we've got to disseminate that. We've got to explain that and make sure that the public at large knows that. But not only that, we have to assure that those people who are experiencing and who are enrolled in this treatment understand that they should be proud of what they're doing, that they are patients of the most effective treatment for their disorder. And together we can make a difference. Together we can change the face of this treatment. I'm not only an advocate, but more importantly, I'm a methadone patient. And I have my life and my recovery thanks to this medication. It has saved my life. It has restored my family. It's given me a second chance. And I want the world to know, methadone and buprenorphine, they're not substitute drugs. They're effective medications that save lives. So join with us. Join with NAMA Recovery. Go to our website, www.methadone.org. Click on Join Now. $25 a year for a membership. That's a small price to pay. But together we can make a difference. And together we are making a difference. Are you going to join us?